Okay.
More than 1.5 million people in this country living with lupus, which is defined as a chronic autoimmune disease that can really damage any part of the body. May is Lupus Awareness Month, and joining me today is Marisa Zeppieri, who's been battling lupus for 9 years. She is now a board member of the Lupus Foundation of America. Good morning, thanks for being here, Marisa.
Thank you so much for having me.
You look fine, you look great. I know you've been battling this for a long time. You got it when you were 23 years old?
Yes, 9 years ago.
How did you know you had it?
I just started not feeling well, and I started, for me in particular, it's different with every patient. I started having fevers, rashes, I was having problems going out in the sunlight, and also for me it manifested in terms of my blood. I began having blood clots, and within a few months I had 2 small strokes. So I had so many symptoms at one time, it was very easy for them to diagnose me, but for some people the average is about 2 years for diagnosis.
Well, I want to get, we'll get back to this in a second, but let's put up, we have 2 pictures to show you. One is during a bad outbreak that you had, what, about a year ago?
That was a flare-up last year.
Let's take a look at that picture and tell us what has happened here.
Well, I almost lost my life last year. I had a flare-up for about 3 months. I was in and out of the hospital. You can see I lost a lot of weight. I was having a lot of heart issues. There's only several medications for lupus, and there hasn't been a new one for 50 years. So I was on
50 years?
50 years. They haven't had a new medication out, and really they were just using the basic medication that they've had. And you know, at that point, they'd almost given up on me, but you know, through my family and faith, I pulled through, and I feel great now.
Let's take a look at the. Is there another picture? Is there
There's
the after picture's right here. You look beautiful.
Thank you.
You made it through, and you don't look any worse for the wear. In South Florida, is this? Do you have any idea of the scope of this disease in this area?
Sure. Well, in Florida, there's about 90,000. In South Florida, in about a 7-county area, we have about 35,000 patients, and that breaks down to about 12,000 in Miami, 10,000 in Broward.
And where do these people go for help if they even know that they have lupus?
Well, exactly. It's very difficult to be diagnosed. The Lupus Foundation Southeast chapter is in Delray Beach. The national headquarters is in Washington, D.C. And if they feel, they can go to lupusflorida.org or my personal website, lupussurvivalguide.com, and they can see the symptoms and see if they're having any of those.
Are the symptoms or the early symptoms well known by typical doctors, or will most doctors not realize that lupus is present?
A lot of doctors, you know, primary doctors, not specialists, sometimes they do miss it because it mimics so many other diseases. Sometimes it gets confused with multiple sclerosis. So it isn't an easy, you know, disease to treat or diagnose because there isn't one magic blood test that says yes, you have it, or no, you don't.
All right, this is Lupus Awareness Month. Is there a specific goal that the organization has in mind to raise? It's hard to believe there hasn't been a new drug in 50 years.
Right.
Is there enough research going on? Obviously, it sounds like not.
There has not been a lot of research because right now they estimate 80% of the public really don't have any knowledge about the disease, so it's very difficult to ask for donations that go to research because really no one understands or knows what it is.
How does it compare in number of victims to other diseases?
Okay, well, most people are surprised when they learn that lupus is actually more prevalent than AIDS, MS, cystic fibrosis, cerebral palsy, and sickle cell combined.
Wow.
There's a lot of people out there that are suffering, and they estimate 5 million worldwide, and 100,000 new cases are diagnosed each year.
What is the drug? The drug that apparently has helped you come back?
Well, a lot of lupus patients use steroids to reduce the inflammation. Some are on chemotherapies. And there's also antimalarials that a lot of doctors will use.
Marisa, thank you so much, and we're so glad that you're doing so well now.
Thank you.
That's what counts. If you'd like more information on lupus, log on to lupussurvivalguide.com or lupusfl.org, or you can call the Lupus Foundation. The number is 561-279-8606.